All right, let's start with all the very latest on COVID-19 and expert analysis from Peter Collignon, Professor of Microbiology at the Australian National University. Peter, thank you very much for your time again.
Thanks for having me.
And we love the bow tie. The bow tie looks the goods. I like that. To hear that two-thirds of the staff at that Summit Care facility were unvaccinated, one, was it a surprise to you? And should we regard it as not good enough?
Well, I don't think it's good enough. I think we do need a high level of vaccination in people who are in positions whether they're either more susceptible or likely to get the infection themselves or send it to others
Yep.
who are particularly at risk. I mean, the most important thing is for all people who are residents in aged care to be vaccinated. And my understanding is probably there's 90% plus of those people vaccinated, but we still have slips because people get put into it just a few months ago. And if you like, the program was rolled out many months ago. So we've got to make sure we catch up with those people. It's a little bit of problem when you've got, quite the logistics of having to do that. But I think we need some system where people who are designated at the most risk, and that's the 1A, 1B categories from before, somehow they have a special phone number they can ring so they get to the front of the queue and they get either AstraZeneca or Pfizer, but they get priority because as it stands, we probably now have got enough AstraZeneca for everybody that needs it over the age of 60, including maybe the 30% of 70-year-olds who still haven't been vaccinated. But Pfizer is still in short supply because it's dependent on supplies from the US. I think we're getting about 300,000 a week now, but there are still a lot of healthcare workers, aged care workers that haven't been vaccinated, and some even drivers of quarantine vehicles. And we need to make sure they're vaccinated as soon as possible, particularly if they're under the age of 60 and that's the preferred vaccine for them, which it is. So we need to actually make sure those highest risk groups, all those in the 1A and 1B, if for whatever reason they're not vaccinated already, in the next week or two, they get at least their first jab and the appropriate one for their age group.
A separate hotline is an outstanding idea. What do you make of the New South Wales infections at the moment?
Well, I think it's stable. It's not out of control. I'd like to see the numbers lower. They will fluctuate from day to day, as the Premier said. And so it's probably more realistic to look at a 3-day rolling average. I still think, they should be able to get on top of this. Because they've done a very good job so far. There's not a lot of mystery cases out there, but there are cases that were walking around in the community because presumably they were casual contacts rather than close contacts. So I think the next few days are going to be fairly critical, providing we don't find a lot of mystery cases, providing there's not a lot of cases that were walking around in the community, and providing also that the sewage detection that's going on for COVID shows that there's not, increasing amounts in sewage, because you can measure the amounts as well. That'll make me feel better. But really, we want to see this come down to, 10, 12 cases a day with, 10 or 11 of them already been in isolation for quite a long period of time.
I witnessed under the sunny blue skies of Sydney over the weekend plenty of rule breaches, no masks, no separation, etc. And a lot of people on the road and on the footpath. But then again, it is outdoors. Are we going through a period of pandemic fatigue, do you think?
Well, I think the rules about being outdoors without masks are entirely appropriate. It's very rare to transmit this outdoors. If you're going to be close to somebody, within 2 meters and you don't know them, yes, wear a mask. But mostly outdoors, you don't see that. A lot of the crowds look worse because of the way they do the camera angles. I think if you had a drone sitting above it, you'd find people were mainly 2 meters apart.
Yeah.
And you're much safer outside than inside. So I think their suggestion about exercise outdoor and recreate outdoors, that is much safer than people, even being inside in the house with their own family. So, look, the more we're outdoors, the better. So I actually think most of the directions I've seen from New South Wales Health are reasonable. I think mostly people are following that. Obviously, people having parties when they shouldn't is not the case. Wearing masks indoors is a very good idea because it decreases the risk to yourself, probably by the order of 20%, but more importantly, it decreases the risk if you've got COVID, you'll send it out to others.
Yeah.
And that's probably the biggest factor with masks. So
I
that's
enjoyed
a very good idea. But so far, anything you do, including a lockdown, it'll take about a week before you see the effects of that. We're not seeing exponential rise. If you look at what's happened in other places, Melbourne last year, it was going just up and up and up. We're not seeing that. So I think there is control of this. Is it as good as I'd like? No, it isn't. But we're in a much better position this year than last year. for starters, 70% of people over the age of 70 are vaccinated, and that's where most of the deaths occurred.
Yep.
I understand about 90% of aged care residents are vaccinated. So we will have less deaths because of vaccination, because with the highest risk groups have got at least the highest vaccine uptake. We need to do better with vaccine, but we should be able to get 1 million doses a week from now on, about 700,000 AstraZeneca or more, 300,000 Pfizer, and come 2 months' time, when we finally get adequate supplies out of the US who've been restricting imports up until, or even now, and supply issues, we should be able to get 2 million people a week vaccinated, in my view, which will mainly be the younger people. So come October, after winter, early spring, when viruses don't spread as readily, by that time we should have, at least 20 million doses of vaccine given. And so, mid-October, we should be in a much better position with, I would think, 70 or 80% of adults at least getting their first dose. And by the end of the year, the vast majority of them, or if not all of them, are close to having their second dose.
I've almost run out of time. Just very quickly, school goes back. In New South Wales, it'll happen after the lockdown. What do we do about vaccinating teachers and students?
Well, students for the moment, I don't think we've got data on children to warrant mass vaccination. And also, while they get infections and can spread it, they do it much less than their parents. 20 and 30-year-olds spread it much more. Right. Teachers are a priority, but they're not as high as the other priority groups we have. I mean, people over the age of 60 are much more at risk of getting COVID and succumbing to it than, say, a 30-year-old teacher. So, look, we do need to keep schools open. We should not be closing schools unless we've got uncontrolled spread, which is not the case. It makes no sense in my mind to close schools if you've still got even restaurants and bars open. Yeah. I mean, they are less of a factor worldwide than a lot of other indoor venues. And there's huge costs, particularly to primary schools, in closing them. Yep. The only advantage of closing schools, which they showed in Texas, it did decrease the spread in the community, but mainly because the parents had to stay home to look after the children, rather than the schools themselves being a big factor in spreading the virus. So
outstanding point. Outstanding point about the parents. I've run out of time.
Don't close them too early.
Yeah, exactly. I've run out of time. Peter Collignon, thank you very much again.
Thank you.
There you go. So you can lock down the kids, but that's not going to get you much. But it's the fact that the parents have to stay home from work that gets you some advantage. Interesting.